Hi, my name is Katrina and now I'm going to go over the procedure for doing an enteral feeding through the NG tube. Okay, so first what I'm going to do is I'm going to check my physician's orders, and then I'm going to gather my supplies, and I'm going to go into the patient's room. Upon going into the patient's room, I'm going to perform hand hygiene, and I'm going to don clean gloves. I'm going to let the patient know what I'm here to do, which is to give a feeding. And I'm going to ask the patient if they have any allergies and compare those against the food that I'm about to administer. And I don't see any problems with that, so I'm going to shake the food. It is at room temperature. And before I start the feeding, I'm going to go ahead and check for residual. I was able to draw up 20 milliliters of fluid, and I'll check that for pH to make sure that I'm still got correct placement, and I do. So the little bit that's there, I'll go ahead and put that back. Before I just give the feeding, I'm going to go ahead and set up my pump or bolus, whichever is ordered, and I'm going to make sure that I prime the tubing and get all that set up. So now that that's done, I'm going to go ahead and issue the feeding, and if it's a continuous feeding, I'm going to check for residual every 4 to 6 hours, whichever is the hospital policy. And if it's bolus, at the end of the feeding, I'm going to flush with 30 milliliters of fluid. And every 24 hours, I'm going to make sure that I change out the bag and the tubing for the patient. And after I'm finished, I'm going to perform hand hygiene, remove my gloves, perform hand hygiene, and I'm going to document what the patient, what the feeding was, what the rate was, whether it was bolus or continuous. I'm going to document the residual and how the patient was tolerating that procedure. Okay, so now we're going to go into removing the NG tube. So treat it like as I'm walking into the room again. I'm going to come in and, well, first I'm going to verify the orders that we are taking the NG tube out, and then I'm going to come into the room and ask the patient to identify themselves with their name and date of birth. And after I do that, I'm going to explain to them that we are removing the NG tube, yay, and I'm going to do hand hygiene and put my gloves on. So first what we're going to do is we're going to put this towel over them to protect them of any mess that may occur. I'm going to give the patient a tissue in case they want to wipe, and I'm going to clean up their nose when we're done too, but just so they have something. And what we're going to do is, I've got my biohazard bag here that we'll be putting this into when we're done, and I'm going to let the patient know that the easiest way to do this is if they can just kind of hold their breath, and we'll just pull it out as swiftly as we can. Remove the tape. In my bag that's sitting here. Oh my goodness. Okay. And then we're going to grab the tube, and we're just going to go 1, 2, 3 and pull out. And we're going to put that into the trash. Okay, I'm going to give the patient, or rather help the patient to clean his nostril that was being used, and we're going to do oral care, and I'm going to remove my gloves and perform hand hygiene. I'm going to document how the patient tolerated that procedure, and I think that's it.